Good morning, everyone. This is the second part of today's lecture series. We're going to be talking about some of the most common substance use screening tools that we can utilize in our practice, as well as the psychiatric or behavioral health assessment form. So again, I am in no way affiliated with this website. I just chose this one because it's easier to navigate and to explain to you guys, you know. So first, we're going to be focusing on AUDIT-C, or Alcohol Use Disorders Identification Test. So the first question is, how often do you have a drink containing alcohol? So, Mr. Juan Luna, gaano ka kadalas uminom ng merong alcohol? The answers can be never as in 0, monthly or less, as in 1. Number 2, scoring of 2 is 2 to 4 times a month. Score of 3 is 2 to 3 times a week. And 4 or more is a score of 4. The second question is, how many drinks containing alcohol do you have on a typical day when you are drinking? So, kada umiinom ka, Mr. Juan, gaano kadaming baso or shots ang iniinom mo? So, score of 0 is 1 or 2. Score of 1 is 3 or 4. Score of 2 is 5 or 6 drinks. Score of 3 is 7 to 9 drinks. And then score of 4 is 10 or more. Third question is, how often do you have 6 or more drinks on one occasion? So, Mr. Juan, gaano ka kadalas umiinom ng more than 6 shots or 6 bottles? So, the scoring can be never, less than monthly, weekly, daily, or almost daily. So one good example is if Mr. Juan said for question number 1, umiinom lang naman ako 2 to 3 times a week. So you click this one. So usually pag uminom ako, mga 3 to 4 na bote ng beer. And usually umiinom ako ng 6 or mas madami sa 6 na drinks. Usually panaka-naka lang, during occasion. So the AUDIT-C score is now 5 points. So similar with the first part of our lecture today, every screening tool that you're going to be utilized has its corresponding interpretation. So for men, a score of 4 or more is considered positive, optimal for identifying hazardous drinking or active alcohol use disorder. Women, a score of 3 or more is considered positive. And if all points are from question 1, assume the patient is drinking below recommended limits, and the medical provider should review the patient's alcohol intake during the past few months. So Mr. Juan answered the score for Mr. Juan's AUDIT-C score is 5. So now it's considered positive. So again, we need not only that these specific screening tools have interpretation, but there's also sources at the bottom. So this is the first one that I want to discuss today. The second one that we can utilize, if it's mostly or if it's only for alcohol, is the CAGE alcohol questionnaire. But what I want to reiterate is clients are not only going to be dependent on alcohol, they can be dependent on other substances like marijuana, shabu, cocaine, opioids, even benzodiazepines like Xanax, Ativan, and so forth. So I prefer to use the CAGE aid instead of the CAGE alcohol only, for the reason that CAGE aid questionnaire includes drugs. So this is actually an adaptation of the CAGE for the purpose of conjointly screening for alcohol and drug problems. So when thinking about drug use, you want to include illegal drugs use and the use of prescription drugs used other than prescribed. So Mr. Juan, how have you ever felt that you out to cut down on your drinking or drug use? So Mr. Juan, minsan ba gusto mo na itigil yung pag-inom mo o yung paggamit mo ng bawal na gamot? Yes or no? So that's the first letter, C, cut down. Second is annoyed. So have people annoyed you by criticizing your drinking or drug use? So Mr. Juan, minsan ba nabibwisit ka na or naiinis ka na pag sinasabihan ka ng mga tao sa paligid mo na tumigil ka na uminom o tumigil ka na gumamit ng droga? So that's annoyed, letter A. G stands for guilty. Have you ever felt bad or guilty about your drinking or drug use? So Mr. Juan, minsan ba nakakaramdam ka na nagigilt ka, meron kang nahihiya ka sa actions mo, sa pag-inom mo, sa paggamit mo na bawat droga. So that's letter G. And E is eye-opener. Have you ever had a drink or used drug first thing in the morning to steady your nerves or to get rid of a hangover? So, Mr. Juan, meron bang panahon na pagising mo gusto mo na uminom? Or pagising mo gusto mo na gumamit ng droga? So, the cage again, cage aid is for alcohol and drug use. Cage stands for C as in cut, you cut down. A as in annoyed, na nabibwisit. G as in guilty, or the client feels bad about the action. And E, eye-opener. So, eye-opener meaning pagising mo palang gumagamit ka ng bawal na gamot or umiinom ka na. So, let's say Mr. Juan feels answered yes for everything. Okay? So now, his cage aid questionnaire score is 4 points. So interpretation is one or more yes responses is regarded as positive screening test. And as always, there will be that sources at the bottom of every screening tools that you're going to be utilizing in your practice. So technically speaking, for part 2 of today's lecture, it is very important for us to make sure that we screen or we ask about substance and drug use, because regardless of if the client is seeing the provider for medical or behavioral health, if the client is struggling with addiction or dependency, everything follows. So I want to emphasize, nurses, that we cannot go out of our scope. Our task is always to make sure we collaborate with our psychiatrist or primary care providers and be aware of and know how to utilize the screening tools that we have and how to give out reports. Okay. So now we're going to be moving forward with the behavioral health assessment. So technically speaking, this is a very, I actually just patterned this one from my current workplace. So this is something that we will need to collaborate on to make sure that everything is on the right spot. But for the purpose of educating our nurses on how to do a clinical assessment form, I just populated this with the most important information that we need to have. So the best person or that should be familiar with using this clinical assessment forms are our nurses and social workers, or even our psychologists. Remember, we want to make sure that we have everything, we have all the information that we need before we can give out reports to our providers. So first is, again, of course, demographics, client's name. We want to make sure we know the gender, the sex, the age, date of birth. You can also include the address here. And also the communication method preferred. So these varies from one office to another. It can be through text, it can be through phone, it can be through email. So it depends with the client. So there are 9 major 9 major areas or sections that we need to be familiar of when we're doing the clinical assessment form. First is the presenting issues and concern. Second is previous hospitalizations and surgeries. Third is current medical condition, primary care provider appointments, and other specialist appointments. Fourth is current medications, including psychiatric or psychotropics and medical medication. 5, allergies and hypersensitivities. 6, family psychiatric medical history. 7, psychosocial, including social, educational, work, legal, living situation. 8 is trauma history. And then 9 is substance abuse history. So let's talk more about this, the specific sections. So what I want our nurses to do or our participants to do is make sure that you jot down your notes. You should be able to receive a copy of all the forms that I am talking about today, specifically these clinical assessment forms, and then you can write anything that you want in that paper for note taking. Okay. So the first one is presenting issues and concerns. So why is Juan Luna in the office today? So, sir, how can I help you today? O ano po ba maitutulong namin? So Juan Luna may say, oh, nandito kasi ako para ako na-depressed, I'm anxious, or I have issues with alcohol drinking or dependency that I want help with. So you're gonna write it here. So presenting issues and concerns natin. Second is HPI, or history of presenting illness. So this is, if you remember when you were in nursing school, we always needed to do a history taking. So this is the HPI. So for what reason is the client here? What happened several days ago, to a week ago, to a month ago, and then you're gonna write it here. Second is the previous hospitalization and surgery. So remember, physical and mental health goes hand in hand. So we always want to make sure that we don't, that we focus on both too. So, Mr. Juan, na-hospital ka na ba before? Na-hospital ka na ba dahil nagka-nervous breakdown ka? Meron kang psychosis? Or may agitation ka na kailangan mo mag-hospital, malagay sa hospital. Second, Mr. Juan, meron bang time in the past na kailangan mong hospital dahil sobrang lasing ka, or you're under the influence of drugs and kailangan mo mag-detox or medical detoxing ang tawag natin? Or meron bang pagkakataon na kailangan mong ma-admit sa isang rehab for substance or alcohol? So that is also included for the previous hospitalization. And Mr. Juan, meron bang pagkakataon na kailangan mong pumunta sa ER kasi feeling mo ninenervyos ka ng usual, more than usual, or dahil meron kang hindi mo feel na stable ka? So for the previous hospitalization, again, it includes ER visits, it includes detox or rehabilitation programs, or even sober living. It also includes psychiatric hospitalization. For the surgeries, it's mostly the medical surgeries, and we want to put it here. So the third one is the current medical condition. So Mr. Juan, kailan mo last nakita ang iyong doktor? Meron ka bang kailan ka last nagpa-blood test sa iyong primary care provider? Meron ka bang problema sa puso, sa liver, sa kidney? Meron ka bang problema sa thyroid? Ano ba yung mga gamot na iniinom mo? So it corresponds between, so it goes hand in hand with number 4, the section 4. Mr. Juan, are you seeing other specialists for maybe heart issues, or pulmonologist if you have issues with your lungs? So everything you need to jot it down. For the fifth one is allergies. You want to ask if Mr. Juan is allergic to any medication, food, or anything in particular. Number 6 is family psychiatric medical history. So what I do is I always ask first if there's any immediate family member who was diagnosed with bipolar, schizophrenia, depression, anxiety, autism, ADHD, ADD, any learning disability in the family, any developmental issues in the family, immediate, and then I ask about uncles and aunts, blood related. After that, I always I also ask, is there any family members that need to be in jail, prison, or in a psychiatric hospital for years and years? Any legal histories in the family? And then I also ask about medical history. So anyone in the family, or can Mr. Juan, ano bang sakit ang meron yung mom mo, or ano bang medical issues meron si tatay? And then you're gonna write it here. Number 7 is psychosocial. So psychosocial in the world of psychiatric mental health, it's very important because we want to make sure that we understand what happened in the past and for us to move forward. So the first usually that I ask is social. So where were you born and who raised you for the most part? If you were raised by your parents, how's your parents like when you were a child? How's your mom? How's your dad as a dad? How's your siblings? Did you move from one place to another? So that is the social. And then I ask about educational history. So how was your grades in elementary school, in high school? Was there any behavioral issues? Mr. Juan, napapatawag ka ba ng principal usually, and for what reason? Are you on any special classes? Are you on any, did you do tutoring? And then what were the usual teachers' report? Diba? Usually the teachers will write the reports in our report cards. So do you remember what are the usual teachers' report in terms of your academics and behavior? So you always put it there. You also want to double check if your client is an adult, if they completed high school, college, or some college, and of course the third one is work. So, Mr. Juan, are you currently employed? What do you do? How long have you stayed in one job? So that's the work. Section, subsection. Fourth is legal. So, Mr. Juan, was there any time in the past that you need to be in jail, prison, juvenile detention, for any reason? It can be for substances or alcohol or for behavior. And then fifth is living situation. So where do you currently live? Who lives with you? How's relationship? Do you get along well? And so forth. And then number 8 is the trauma. So I want to emphasize that trauma encompasses a lot of things. So you want to make sure that you ask first is growing up and at present as an adult, is there any physical abuse? And then you're going to write it. You always want to make sure that you also tell Mr. Juan that Mr. Juan doesn't need to tell you all the details because it's very anxiety provoking for them, but at least you know the specific kind of like specifics, but not the details, you know. Second, so first again is you ask, is there any physical abuse growing up and as an adult? Second, is there any sexual or being molested in the past, being raped in the past, as a child growing up and as an adult? Third is any emotional abuse as a child growing up and as an adult. So physical, sexual, mental abuse. Fourth is anybody died in the family, losses in the family that you struggle the most, or even accident that you struggle the most to accept. So you also include that. So again, trauma encompasses a lot of things. And then also you want to emphasize that you also need to ask, was Mr. Juan in the military in the past? And then yeah, in terms of being in the military. you want to include it also under psychosocial, not the trauma. And lastly, I want to emphasize is the substance abuse history. So, Mr. Juan, meron ba pagkakataon na nalulun ka sa droga, nalulun ka sa alcohol? You may always want to be more specific and make sure that you rephrase Mr. Juan's answer, because to be honest, they will not admit that they struggle. Usually what they will say, oh, umiinom lang ako ng konting bote, in a day, or umiinom lang naman ako ng several days in a week. You always want to make sure that you rephrase that and ask specifics. So, Mr. Juan, ibig mo bang sabihin ng specifics 3 to 4 times a week? Or, Mr. Juan, ibig mo bang sabihin ng konting bote 3 o 5 bote? So they're not gonna get mad, we just want to make sure that we know in that aspect. And remember, when we were discussing about screening tools, this is where you're going to put the scoring for the CAGE and for the AUDIT-C under the substance abuse history. For the first part of today's talk about mental health screening, you're going to put your scores under the HPI, so it's easy to check on. So again, specifically for our behavioral health clinical assessment form, we want to make sure that we focused on the presenting issues, number 1. Second is previous hospitalization and surgeries. Third, current medical condition. Fourth, current medications. Fifth, allergies and hypersensitivities. Sixth, family psychiatric medical history. 7, psychosocial, including social, educational, work, legal, and living situation. 8, trauma history, and then 9, substance abuse history. So this is for the second part of today's lecture. You can stop your screen and then work on your exercise and activities. You can always go back to watching my videos and then doing the activities.